Okay, welcome to the frog dissection here with Mr. K, and we are going to dissect a frog. Maybe you were absent for the dissection, maybe you felt a little uncomfortable doing the dissection yourself, or maybe you really just enjoy watching dissections. Whatever the case may be, we're going to get through this together here. We are going to start by looking at the external features of the frog here. We've got the two body regions here. We have the head, and then we call this the trunk here. If you look at the legs of the frog, the hind legs and the forelegs here, these hind legs are very strong and muscular, made for jumping and swimming, and the forelegs are for providing balance and helping the frog as it lands from a jump. Now if we look at the toes here, look closely at the toes, compare the toes of the forelegs to those of the hind legs, you'll notice a few differences here. Obviously in the length and size of the toes. If you look at these back toes, these are webbed, while the ones up front are not. Okay. Next, if we look at the frog's eye, get a good shot here. The frog has a third eyelid. It's a clear eyelid called the nictitating membrane. Not sure if we can see this or not. So it has eyelids like you and I, but it also has a third eyelid, which is clear, which it can kind of still see through while it's underwater. So it can have its eyes protected. We have the frog's eardrum, or tympanum. All right, so it uses that to hear. Obviously, look at the skin of the frog. The skin is very moist. The frog is able to kind of breathe through its skin. Oxygen is able to diffuse through the skin into the bloodstream. So it does have lungs like you and I, but it also can get oxygen through its skin. We have camouflage to blend in with surroundings. So if you were a predator looking from above, this camouflage would help blend in. And also, if the frog is in the water and swimming, if you were a fish and you were underneath the frog, if you were to look up, this is lighter color here. So if you were to look up as a fish and see this lighter color, it would actually kind of help blend in with the lighter color of the sky. Okay, obviously it's not blue, but it is lighter and does help the frog kind of blend in a bit. All right, so now we're actually going to take a look inside the frog's mouth here. One other item that I didn't point out are the nares, these external nares or nasal openings, okay, the nostrils. We are going to open the frog's mouth here, and they tend to not be very cooperative, so we need to snip the jaw on either side, and that's going to allow us to open this mouth nice and wide here. Okay, so looking inside here, we have, these are the, let me get a better angle here. These are the nostrils, the internal nares, so these external nares go and open up inside the mouth here. The frog has two sets of teeth. Around the outside of the jaw here are the maxillary teeth, and then there are two teeth in here that you can see. You can hear that or not. There and there, these are the vomerine teeth. Inside the mouth, we have the tongue, obviously. Notice how the tongue is attached at the front to fling out and capture prey. In a living frog, the tongue would be sticky. And then we have the gullet, or the glottis, which is the opening to the esophagus. And then on either side, you see these holes here. We've got one here and one here. These are the eustachian tube openings, okay? And if we put a probe in there and we follow the eustachian tube, we see, if we push on it, you see that it comes out at the eardrum or the tympanum, all right? So we are going to actually start to dissect the frog. I'm going to do a little pinning here to make things a bit easier. Normally when I'm dissecting, I kind of spin the tray as needed so that I'm not awkward. My body's not positioned awkwardly when I'm making cuts, but I don't want to make you watching the video dizzy. So I'm going to try to do this way. So we'll start with, I got a backup pair of scissors here. We'll start with a cut up through the skin layer. And we're going to cut all the way up to the pin here. And then we're going to do 2 lateral cuts underneath the forelegs and then above the hind legs on either side. And what we'll find is that there's this translucent kind of membrane here holding the skin to the muscle, so I just kind of gently scrape that with a scalpel. Keep that handy. And I find if I go all the way down, almost around the frog's back, that I don't have to pin that skin back. It just kind of falls back on its own. Again, an awkward angle here. Finish the cut. And then I'm going to repeat this same cutting pattern through the muscle layer. All right, I've gone up through here, and I find that it's easiest if I snip a little hole in the muscle layer like that, and then go up with my scissors. And you want to be careful when you're doing this that you don't have your scissors pointed downward. Again, I'm going to do those 2 lateral cuts. One down here. Got a little membrane here that's hanging on. And again, same deal. If I bring this lateral cut all the way down, it'll really almost kind of stay down on its own without pinning. Try this side here. Again, awkward angle for me here. Oh, my arm's right in the way. I'm actually moving around the table here. Again, normally I would spin the dissecting pan so that it's comfortable for me to work, but I don't want to make you dizzy. Some of you aren't wild about watching this to begin with, so there's no reason to get you dizzy, give you motion sickness while you're trying to watch a dissection video. That's not a good combination. All right, my pins are coming out here. All right, there's that, and then I'm going to be cutting up through the sternum or the breastbone here, so I can get a good look inside. Move these out of the way, and then I'm going to pin here and here. Okay, so now we have a nice clear view of everything. So looking inside here, what are we looking at? Well, we notice right off the bat we see these yellow, a lot of the kids say these look like noodles. These are fat bodies. This is a way for the frog to store energy here. We have the largest organ here, right in the abdominal cavity, is the liver, and you'll see the liver has 3 lobes. All right. If I were to look under the liver, where is it here? I'm looking for the gallbladder. Okay, here's the gallbladder, right here. This is the gallbladder right here. Kind of looks. This frog has been stained. Its arteries and veins have been stained with a latex dye, so the arteries are red and the veins are blue. And so it's kind of bled into some of the other color, or the other organs as well. So this gallbladder here is normally kind of green. It reminds me of a pea, all right, like a pea that you'd have with your dinner, kind of wrinkly here. That is the kind of little storage stack for bile. Our liver here, we've got 3 lobes of our liver that is responsible for making bile, that helps frog digest fats, okay? Underneath the liver, we've got the stomach right here. It's large, it's muscular, it's very firm and muscular. And then as we follow this down, we've got the pancreas in here. The pancreas in the frog is really hard to see. It's really, usually you don't end up seeing it. So a lot of kids spend a lot of time looking for it. You're not going to find it if you don't see it. It's not a very obvious thing to find. We've got the duodenum or duodenum here, right, leading from the stomach to the small intestine. And then all of these coils of the small intestine are called the ileum. All right, and that's all coiled up. And then you'll see, I'm going to get my hands out of the way here. You'll see right here where we've got our small intestine, and then it transitions and gets real fat here. And that is transitioning from the small intestine to the large intestine, or the rectum on some of your diagrams. Looking back here, we see we have a female frog. These are eggs on this side and on this side. And then these coils down here, this is the ovarian tissue. This is the tissue responsible for producing the eggs. I'm going to start by removing the eggs, and the easiest way to do that is if you can get them all at once, or most of them all at once with your fingers, that's the best way to do it. If you try to use the forceps and pick it apart a little bit at a time, then you're going to have a mess on your hands. So this is actually kind of a pretty neat way to do it, as neat as you can be when you're doing a dissection. All right, so we got those eggs out of our way. I'm going to start by removing the liver. Now when I do this, I need to be careful that I don't damage the heart. Okay, so the liver is in 3 lobes. So I'm just going to use my scissors and my forceps here, kind of snip away. Again, just being real careful that I don't get the heart accidentally. We'll get the heart later. And that gallbladder will come out with it too, and that's all right. Okay. One of the other organs that we will see kind of in the membranes or mesentery of the digestive system is the spleen. And I'm going to move this right back here. And if you look, this here, it's kind of a reddish brown, looks like a kind of a bean. That is the spleen right in there. And what I'm going to do now is I'm actually going to remove as much of the digestive system as I can. And the way I do that is I'm going to cut as high as I can on the stomach, near the esophagus here, and as low as I can by the large intestine. The other thing I want to point out to you here, this right here is the frog's bladder. All right? It's empty right now, so it's just kind of a loose, floppy sac here. But that is the bladder that holds the urine until it's released from the body. So we'll see how cooperative this stomach is. The stomach is very muscular and tough to get to. So I'm going to cut with the scissors. Actually, it's not being too uncooperative here, so that's good. It's going to get through. I may call on the scalpel for a little help if I need it, but actually no, it's actually doing all right here. Just removing these membranes here, and then I'm going to snip as low as I can beneath the large intestine. Okay, and I'm going to just kind of take the whole thing out, snipping these membranes as needed to remove it. There's that latex dye. All right, so this is the whole digestive system here. What I'm going to do is I'm going to actually stretch this out. Let's see if I can do it without breaking it. This is really delicate. And what I do is I pin the stomach down, and I just kind of put some tension on it here, And as needed, I'll kind of nick away at the membranes. The spleen is up in the membrane here. That's no big deal. And what I want to do is I want to see if I can't stretch this out and measure the small intestine. Again, it's kind of fragile. Be careful I don't accidentally cut the small intestine. So it's hard to, I can't get all this in the shot, but take my word for it. So here's the other end. I'm holding onto the large intestine, and if I measure from the large intestine to stomach, what is that? That's about 23 centimeters. Okay, so pretty lengthy for an organism this size. All right. So the other thing I'm always interested in seeing is what, if anything, does the frog have in its stomach? All right. So I'm going to remove the small intestine. Get that out of the way. And then I'm going to open up the stomach here. Always use the forceps to hold the stomach when you're cutting into it. And then use the scalpel here. Don't use your fingers with the scalpel that close to it. Let's see what we find here. Anything in here? So this guy must have been, or this gal, I should say, must have been hungry because there's nothing in the stomach. You can see how muscular the stomach is. It's very tough to the touch. But this, again, that the stomach does a lot of mechanical digesting, especially in the frog where it doesn't really chew like you or I chew our meals. All right? So that's the stomach. That's pretty much the digestive system. From here, we are going to take a look at the respiratory system, what we can, and I'm going to remove some of this fatty tissue here, if I can. I don't want to damage anything. Let's see if I can't just kind of snip some of that away. All right. So what I'm going to try to find now, I'm going to try, if I can, to find the lungs. And it looks like here's one here. These are kind of tucked back up in here. I'm going to remove, here's the rest of the remainder of the liver. I'm going to take that out. This is the heart here. I got to be careful that I don't damage the heart. But behind the heart here, and these are bright pink in this particular frog, again, because of that latex dye. Here are the lungs. Okay, these are the breathing organs. See if I can't pull that down a little bit. Here's one lung, and then here's the other lung. Okay. Next is the heart. All right. So the heart has this pericardium, or this membrane around it. So that's the first thing that I would do, is remove that. And then let me see if I can't remove the heart so I can work with it a little more easily here. I'm going to try to cut it up high here, if I'm able. And the frog's heart, same function as the human heart, but operates quite a bit differently. The frog's heart has 3 chambers. The human heart has 4. All right. So this is the heart. I'm going to see if we can't get this membrane off. So the frog's heart, like I said, has 3 chambers. There has 2 atria, one coming from the body and one coming from one receives blood from the rest of the body, and the other receives blood from the lungs. And these atria are located on top, and they're not a muscular chamber, so sometimes hard to identify because they're really kind of floppy. And then the ventricle is the pumping chamber. So that's the muscular chamber. So I'm going to cut this crosswise. Let me use forceps here. Let's see what we're able to see. I'm having a tough time discerning the atria here. Ventricle is easy to find. It's the big muscular pumping chamber, but I'm wondering if I kind of slice this and open it up, what we'll see here. All right, so you can see the muscle, see how muscular that ventricle is, and then the atria are not that muscular. I can do this without getting my hand in the way. Not used to doing this on camera here. All right, so there's a nice cross section of the muscular ventricle on the bottom, and then the atria on top. There's some coagulated blood in there, it looks like, remainders. So there's an atrium right there and one right there, and then the ventricle on the bottom. Next, we're going to look for the kidneys. So this is, again, we talked about the reproductive, the ovarian tissue that produces the eggs in this female. I'm going to try to remove this. Actually, I see a kidney right here. This is stained blue. Normally they're kind of a reddish brown color. Let's see if I can't get to this a little better. So when you dissect, you'll notice there's a lot of membranes holding things together. You never have to worry about organs falling out, even if the frog is opened up, because there's all these membranes holding everything in place. And let's see if we can't find the kidneys and see them underneath there. I'm trying to get a good clear view of them. So what I'm doing, I'm removing the membranes here so you can see either kidney here, one on each side, and you can kind of see the reddish brown color of the kidney. Again, snipping membranes here. Okay, so I've got a kidney right here in the forceps. So here's one kidney, and then here's the other right here. In fact, I think I'm going to remove them and so you can see them more clearly, if I'm able. Again, lots of membranes holding things together. So here's the back side of the kidneys, you can see. Okay, here's one, here's the other. It's probably as clear of a view as you're going to get there. We've talked about the reproductive system. We saw the eggs. We saw the ovarian tissue. Next, we're going to look at the muscular system. And what we're going to do is we're going to look at one of the legs. So I'm going to unpin this frog. Actually, you know what I'm going to do is I'm going to spin this upside down. Don't get seasick on me here. All right. And I'm going to focus on one of the legs. And what I'm going to do is I'm going to remove the skin from one of the legs. You can do this without damaging the leg. And if you snip the skin around, if I can get that, you can actually peel it back. I'm going to remove this glove so I can get a better grip. Maybe. I just wear gloves because I have my hands in these things all day long. And the preservative can kind of dry out your skin somewhat. So, there we go. A little bit of a muscle tear, no big deal. And here we can see the muscles we can see the tendons, these white tendons that attach the muscles to the bone. And if we look here, you can see these individual muscles. But you remember how the muscles work in pairs, all right? When one contracts, the other one extends. So if this one contracts, and you can see if I pinch this to contract it, this one extends, excuse me, and that makes the foot bend. So I'm extending that foot just by pinching this muscle and making it contract. All right, well, that bell means I am out of time, and we've actually made it through the whole dissection. Thanks for watching, and enjoy your frog.